Alright, so I'm here at the office. I'm with Allison, I'm also with Jen, and we're about to do my first BBL as well as Halo treatment. So we're going to kind of do a series of videos to show you what this is experience is like. BBL should be done every quarter. It's basically every 3 months. The reason for that is that it really does help to erase some of the UV damage, that chronic and oxidating damage that we do see. So loss of collagen, decreased in your quality of your collagen, as well as hyperpigmentation, which happens from sun exposure. For me, I've got both the hyperpigmentation as well as some vascular issues. So I've got lots of little blood vessels that are starting to show up in my skin around the nose. So we're going to treat those today, and we're going to follow that immediately by a Halo. A Halo is erbium resurfacing. It's fractionated, which means that it is a great way to stimulate collagen production, erase some of the damage that's happened, but also allow for a very quick downtime. So my downtime is going to be anywhere from 2 to 4 days, but I'm going to work right through it. I'll be more swollen around days 2 and 3. I'll be wearing sunscreen and other skincare products by day 4. So here we go.
The Halo will get a lot of your pigment too.
How's it feeling?
It actually feels okay. It's like just a bright light and a little snap, but not even as bad as a rubber band.
A lot of people say the base pass is very relaxing.
What's the difference in the settings between the base and the second pass you're going to do?
Well, this is the second pass. So first,
With the BBL, we're doing the first pass, which is the base pass on the left side right now.
yes, so this is going to help with collagen, and it also help bring up whatever kind of damage is lingering. And then if there's still stuff to get, then we'll do the step 2, which is the corrective pass.
So I know my forehead, I have a fair amount of hyperpigmentation, so I noticed you changed the parameters on the machine. I could hear you pushing the buttons. Tell me exactly what you're doing.
So I'm changing the parameters of the machine to specifically target certain things instead of doing like what we did with the IPL machine where I would just do it and hope it would pick up what I want.
Yeah.
This way I can actually pinpoint and target exactly what we're trying to treat, whether it be pigment, veins, rosacea, skin texture, whatever. So right now we're kind of adjusting so it picks up on more pigment.
Okay, awesome. All right, so we're just finishing the second pass of the forehead, and actually it's a little different than the first pass, slightly more heat, but for the most part, not really increased discomfort. I just feel like it's warmer. Is that pretty normal?
Yeah, that's completely normal. I mean, we just went over your skin, which you already heated up a little bit.
Awesome.
Yeah, but it shouldn't be like super uncomfortable either.
So now we're doing the rosacea pass. This is a different setting that you can use on the BBL machine.
Yeah, a little bit more heat than the last one, for sure.
Yeah.
So this is a setting we were telling you about that will treat vascularities.
And redness and flushing. Actually, so that one got you pretty.
So this is Halo. So we're using erbium, and we're also using a second setting, right, to create more inflammation?
Yeah, so we're creating a little bit more heat, which will be more downtime but better results.
So I mean, I can expect to be fairly swollen tomorrow, right?
Yeah, it's going to be pretty swollen.
But I mean, it's no problem to go in public or...
No, and your face won't feel sensitive, it'll just look worse than it feels.
Alright, so I just did Halo. I've done it of the cheeks. We did a number of passes. The goal is to get to the end result, which is different for everyone, but essentially we're delivering a certain amount of treatment to the area that we're treating. So we first measure that area, and then we actually treat the area. So for me, we went really aggressive on the cheeks, and I'll tell you, I could barely get through the first few passes without using Cronox. With Cronox, it makes it super easy. So right now I'm on the forehead. I'm no longer using Cronox. Cronox is basically a way to decrease any discomfort that you're experiencing. But for the forehead, because we've changed the settings so they're not as intense, I'm not using it anymore. I'm excited to see what these results are going to be like. I know I'm going to be swollen, that's for sure. Alright, so I'm at dinner now. I just got done with my Halo BBL. You can see it's a little swollen, a little red. It feels kind of tight. You can see how I'm kind of getting swollen through here and lower lids. But you know, sometimes you gotta have dinner with your mom, your sister, and your niece. Taylor, you say hi?